Welcome students, this is the continuation of health and hygiene chapter. In this class we are going to learn about safety and first aid. What is first aid? First aid is a immediate treatment given to the victim of trauma or sudden illness before medical help is made available. First aid is important for following reasons: to save the life, then it prevents further bleeding and determine the condition of the patient, then it relieves the pain, it provides a medical care available at the earliest. Burns. The tissue damage caused by heat, chemical, electricity, sunlight or nuclear radiation is known as burns. So what is burn? The tissue damage caused by heat or chemical or electricity, sunlight or nuclear radiation. Mostly burns are caused by scalds, building fires, flammable liquid and gases. Burns are caused by these reasons. There are three types of burns according to degree of burning. So types of burns are first degree burn, second degree burns and third degree burns. Let us see them one by one. First degree burns. It affects only the outer layer called the epidermis of the skin. So in this burn, it affects only the outer layer of the skin. Second degree burns damage the epidermis and the layer beneath it. So first degree burn affect the outer layer, that is called epidermis, but in second degree burn damage the epidermis and the layer beneath it, that is called dermis. So in this burns it damage the epidermis and the dermis. Third degree burns involve damage or complete destruction of the skin to its full depth and damage to underlying tissues also. So people who experience such burns often require skin grafting. See the picture. So this is first degree burn. So in this only the outer layer of the skin is damaged. In second degree burn, it damaged the epidermis and the layer beneath it called the dermis. Then the third degree burn involves the damage or complete destruction of the skin. Damage to underlying tissues also. So these are the three types of burns. What is the first aid for burning? In case of minor burns, the affected area should be washed with cold water and an antiseptic cream should be applied. In case of severe burns, where deeper layers of tissues get destroyed and blisters appear, use of water should be avoided. The burnt area should be covered with a clean, non-sticking cloth or bandages. So these are the first aid. In case of minor burn, the affected area should be washed with cold water and an antiseptic cream should be applied. In case of severe burn, use of water should be avoided. Then the burnt area should be covered with a clean non-sticking cloth or bandages. Larger burns need immediate medical attention. It is very important to keep a fire extinguisher readily available. So these are the first aid of burning. Next, cut and scratches. Cut and scratches are the areas of damage on the surface of the skin. A cut is a line of damage that can go through the skin and into the muscle tissues below, where a scratch is a surface damage that does not penetrate the lower tissues. So cut is a damage that can go through the skin and into the muscle tissues, but scratch is surface damage only, that does not penetrate the lower tissues, only the surface damage. Cuts and scratches may bleed or turn red, become infected and leave scars. Then what is the first aid for cuts? For minor cuts, the affected area should be washed with cold running water and cleaned with an antiseptic liquid. Then an antiseptic cream should be applied on the wound and sterilized bandage should be tied to prevent infection. If the cut is deep, a clean cotton pad should be placed on the cut and pressed, and the injured portion should be taken to a doctor immediately. See the picture. If the cut is deep, clean cotton pad should be placed on the cut and pressed. For minor cuts, the affected area should be washed with cold running water and cleaned with an antiseptic liquid. Then apply an antiseptic cream on the wound and sterilized bandage should be tied to prevent infection. Basic cleanliness and protection. The most important thing is to help anybody, but you must also protect yourself from HIV and other blood-borne diseases. When you help someone who is bleeding, you should wear gloves or a clean plastic bag on your hands. So, when we help someone who is bleeding, we must wear gloves or a clean plastic bag on our hands. Be careful not to prick yourself with needles or other sharp objects around the person you are helping. So these are the basic cleanliness and protection. Students, hope you all understood about the safety and first aid for burning and first aid for cuts. Thank you.